So, Bismillah Rahman Rahim. So, in continuation of our previous topic of pharmaceutical powders, so today we'll learn about that medicated powders. Last time we have learned the various type of powders, so we learned what are medicated powders. So, medicated powders. So now read the lesson carefully. Some medicated powders are intended to be used internally and others externally. They have used for both internally and for externality. Different powders have been used. So most powders for internal use are taken orally. Internally used powder are taken orally by mouth. What they do after mixing with water, or in the case of infants, in their infant formulas. Orally, because either you have to take these powders with the help of water, or in case of infants, in their infant formula and milk, they have to be added and they have to be taken. So some powders are intended to be inhaled for local and systematic. So there are three routes of administration can be applied: locally, externally, orally, and inhaled for local and systematic effects. So three routes of administration are used for medicated powder. One is externally, internally for orally, and also inhaled for local and systematic effects. So other dry powders are commercially packaged for constitution with the liquid solvent. So other dry powders are commercially packaged for constitution with a liquid solvent or vehicle. Means they are reconstituted with a liquid solvent or vehicle. Some for administration orally, other for use as an injection, still others for use as a vaginal douches. So still the powders, they are reconstituted with the help of a solvent or vehicle, or some for orally and other for use as an injection, and still others for use as a vaginal douches can be used. So still the powders can be used in different other forms. Liquids, some they have to be added as liquid after the reconstitution, and some have to be taken for injectables, and some for vaginal douches powders can be used. So further we can say medical powders for external use are dusted on the affected area for a sifter type container or applied from a powder aerosol. So either they apply through the help of aerosol, or their sifter are placed through small holes of container. So they are used with a sifter type container applied from a powder aerosols. So powder intended for external use should bear a label marked external use only or a similar label. So must be written those which are to be used or externally, label that they only and only can be intended for external use, because they cannot be taken by mouth, they cannot be taken, there may be their problem. So must be labeled with the used for external. So medical powders for oral use may be intended for local effects. For example, laxatives or systemic effects or analgesics can be used and may be preferred to counterparts, tablets and capsules by patients who have difficulty swallowing solid dosage form. They may be converted to powders from tablets or capsule because the patient who cannot swallow solid dosage forms, so they can be used for the patient for orally. So the local effects of laxatives or system effects for analgesic can be used. Or the patient who cannot swallow the solid dosage forms, they can be converted to powders and they can be easily swallowed to the patients. The doses of some drugs are too bulky to be formed into tablets or capsules of current size. So they may be administered as a powder. So sometime when you are going to formulate a tablets, they need some more excipient. So its bulk has been increased, which is difficult for swallow. So these powders can be administered. For administration, they can be mixed with a liquid or soft foods. Sometimes you can spray over the food, sometimes with the liquid, they are to be taken. Now, bulk and divided powders. Medical powders may be provided to the patient in bulk or may be divided into unit of use packages. Some powders are packaged by manufacturers, whereas others are prepared and packaged by the pharmacy. So what happened to? So their finished products can be given by the any manufacturers, a firm, and sometimes the pharmacist in his retail pharmacy or in a community pharmacy, they can prepare these packages. Now powders, bulk powders. Among the bulk powders available in pre-packaged amounts are antacids, example sodium bicarbonate and laxatives, xylem metamucil, which the patient takes by mixing with water or another beverage before swallowing. DOSAGE powders dissolved in warm water by the patient for vaginal use. Anti-infectives, example bactricine and polymyxin beta sulfate, or antifungals, example tolenaf, tolenafate, medicated powders for external application to the skin, usually topicals, Brewer's yeast powder containing B complex, vitamins, and other nutritional supplements. In some cases, a small measuring scoop, spoon, or other devices dispensed with the powder for measuring the dose of the drug. So in certain containers, they can provide, they can add scoops or spoons for the right dose, which has to be given. Dispensing powders, medication in bulk quantities is limited to non-potent substances. Powders containing substances that should be administered in controlled dosage are supplied to the patients in divided amount in folded papers or packets. Patients should be educated about appropriate handling, storage, measurement, and preparation of bulk powder, prescription and non-prescription powder products, in addition to the customary customary counseling at the time of dispensing or purchase. Generally, these products are stored at room temperature in a clean and dry place. These products should be kept out of the reach of children and animals. Patients should be instructed how to measure the appropriate amount of the powder and be told the type of liquid or vehicle to use to deliver the medication consistent with package or physician instructions. Now, bulk powder for internal use. When accuracy of dosage form is not required or is not important at that time, powders are dispensed in bulk form. Bulk powders contain several doses of powders. They are supplied in wide-mouthed containers that permits easy removal of a spoonful powder. The non-potent substances which are supplied in bulk are antacid and laxatives. For example, rhubarb powder, etc. Bulk powder for external use. Bulk powder for external use are non-potent substances. These powders are supplied in cardboard, glass, or plastic containers, which are often designed for the specific method of application. The dusting powders are supplied in perforated or sifter top containers. The bulk powders, which are commonly used for external applications, are followed. They are dusting powders, insufflations, snuffs, dentifrices. Bulk powder for external use are dusting powders. These are used for external application on the skin and generally applied in very fine state to avoid local irritation. Therefore, dusting powder should be passed through sieve number 80 or 120 to enhance their effectiveness. Dusting powders are two types. One is medical, second is surgical. Medical and surgical dusting powders are free from pathogenic microorganisms. Medical and surgical dusting powders before use must be sterilized by dry heat method at 160 degrees centigrade for 2 hours. Surgical dusting powders are used in body cavities and also used on burn case and umbilical cord of infants, whereas medical dusting powders are generally used on superficial skin conditions. In the preparation of dusting powders, the talc or kaolin starch are used commonly because these are chemically inert. But such ingredients are readily contaminated with pathogenic bacteria, so these must be sterilized before their use by dry heat sterilization method. The dusting powders are dispensed in sifter or aerosol containers. Dusting powders are generally non-toxic, but inhalation of its fine powders ingredients by infants may lead to pulmonary inflammation, so proper care should be taken while handling. Antiseptic, astringent, absorbent, and antiperspirant. Example recipe of dusting powder. You may have purified talc, sterilized 50 gram, starch powder 25 grams, zinc oxide powder 20 grams, salicylic acid powder 5 grams. Procedure. Weigh accurately all the powders and mix them ascending order of their weight. Pass the mixed powder through sieve number 85 or 120. After sieving, mix these lightly and transfer into sifter top container and protect it from atmospheric contamination. Direction applied on the affected part 2 or 3 times a day. Uses zinc oxide used for astringent and antiseptic and salicylic acid used for antiseptic and fungicidal. Insufflations. These are medicated dusting powder. They are introduced into body cavities such as nose, throat, ears, vagina with the help of an apparatus insufflator. Nowadays, the insufflations are available in the form of pressure aerosols, and these aerosols used for potent drugs. Insufflations are used to produce a local effect in the treatment of ear, nose, throat infection with antibiotics or to produce a systemic effect from a drug that is destroyed in the gut. Snuffs. These are finely divided solid dosage form of medicament which are inhaled into nostril for antiseptic, bronchodilator, and decongestion action. Snuffs are dispensed in flat metal boxes or glass container with inked lid. Dentifrices. These are applied on tooth surface with the help of brush and that contains suitable detergent or soap. Some abrasive substances and suitable flavoring agents are involved. Abrasive agents such as calcium sulfate, calcium carbonate, sodium carbonate, and sodium chloride are used in fine powder. You can have a recipe of hard soap powder 50 gram, calcium carbonate powder 935 grams, saccharine sodium 2 grams, peppermint oil 4 ml, cinnamon oil 2 ml, and methyl salicylate 8 ml. A simple and compound powder for internal use. In this form of powder, each individual dose is enclosed in paper. The number of ingredients is one, that is simple powder, while more than one is compound powder. The minimum quantity of each powder should not be less than 100 milligram for it can be handled conveniently by patient and can be weighed accurately. Simple powder. And simple powder contains only one ingredient either in crystalline form or amorphous form. If powder present in crystalline form, then it is reduced to fine powder, weighed the powder and divided into number of doses and wrapped as individual dose. Dispense 6 powder of aspirin. Each powder contains 300 milligram of aspirin. You can have a recipe of aspirin 300 milligram. Procedure. Powder. This aspirin and weigh the required quantity of aspirin. Weigh 300 milligram of aspirin for each powder and wrap each powder in individual powder paper. Direction: one powder to be taken after every 8 hours. Compound powders. The compound powders contains two or more than two substances which are mixed together, then divided into desired number of individual doses, then dispensed into each powder paper. Example: dispense 8 powders of APC. Each powder contains 500 milligram of APC. Now the aspirin 300 milligram, paracetamol 150 milligram, caffeine 50 milligram. Procedure: weigh accurately of each powder and mix them as per ascending order of their weight. Weigh 500 milligram of the mixed powder for each powder and wrap each dose individually in powder paper. Powder enclosed in caches and capsules. Caches are solid dosage forms of drugs, and caches are also called as wafer capsule. These are molded from rice flour, rice paper prepared from mixture of rice flour with water enclosed in between two hot polished cylinders. Then water evaporates and wafer is formed. In the caches, zero point 0.2 to 1.5 gram nauseous or disagreeable drug in powder forms are enclosed. Caches are quite hard, so before swallowing, they are dipped in water for a second and then placed on the tongue and swallowed with draught of water. After swallowing, the caches gets disintegrated and drug is released. Advantage of caches: made easily, disintegrates quickly in the stomach, drug can be easily dispensed. A large dose of drug can be swallowed by using caches. Disadvantage of caches: they require soften before use or swallowing. Easily damaged, cannot be protect the enclosed drug from light and moisture. Shell of caches are fragile, so drug contents cannot be compressed. They are not suitable for filling the drug in large scale. They occurs more space compare, compare with tablets and capsules, solid dosage forms. Caches are two types: wet sealed caches and dry sealed caches. Now, wet seal caches. A wet seal cache is made up of two similar convex halves having flat edges. The weight of powder drug is placed in one half. The edge of other half are moistened with water and placed exactly over the first half containing the drug. The flat edge of both the halves are pressed together in order to seal it perfectly. Now, divided powders. After powder has been properly blended using the geometric dilution method for potent substances, it may be divided into individual dosing units based on the amount to be taken or used at a single time. Each divided portion of powder may be placed on a small piece of paper that is folded to enclose the medication. A number of commercially prepared pre-made products are available in folded papers or packets, including headache powders, powders, laxatives, example xylem mucilide, cholestyramine resin, nauseous powder, example messenger powder packets. Divided powders may be prepared by the pharmacist as follows. Depending on the potency of the drug substance, pharmacist decides whether to weigh each portion of powder separately before unfolding in a paper or to approximate each portion by using the block and divide method. But the latter method used only for non-potent drugs. The pharmacist placed the entire amount of the prepared powder on a flat surface, such as porcelain or glass plate, pill tile, or large sheet of paper, and with a large spatula forms a rectangular or square block of the powder having a uniform depth. Then using the spatula, the pharmacist cuts into the powder lengthwise and crosswise. Square block of the powder having a uniform depth. Then using the spatula, the pharmacist cuts into the powder lengthwise and crosswise to, delineate the appropriate number of smaller uniform blocks, each representing a dose or unit of medication. Each of the smaller block is separated from the main block with the spatula transferred to a powdered paper and wrapped. The selection of the type of paper is based primarily on the nature of the powder. If the powder contains hygroscopic materials, waterproof or waxed paper should be used. Powders containing volatile components should be wrapped in waxed or glycine powders. Powders containing neither volatile components nor ingredients adversely affected by air or moisture are usually wrapped in a white bond paper. A disadvantage of dry powder: one is difficult to protect from atmospheric moisture or oxygen, not well suited for dispensing of many unpleasant tasting hygroscopic drugs. Preparation is time consuming, therefore more costly. Advantage of dry powder is it is a flexibility, dissolve more rapidly than compressed solid dosage forms, rapid therapeutic effect, stability, ease of administration. Powders taken orally for systematic use may be expected to result in faster rates of dissolution and absorption than solid dosage forms because there is immediate contact with the gastric fluids. A primarily disadvantage of the use of oral powder is the undesirable taste of the drug. Some medications, notably antibiotics for children, are intended for oral administration as liquid but are relatively unstable in liquid forms. They are provided to the pharmacist by the manufacturer as a dry powder or granule for constitutions, with a specified quantity of purified water at the time of dispensing. Under label conditions of storage, the resultant product remains stable for the prescribed period of use, generally up to 2 weeks. You can see in this picture, this is dry powder syrup. Aerosol powders. Some medicated powders are administered by inhalation with the aid of dry powder inhalers, which deliver micronized particles of medication in meters quantities. Most of these products are used in the treatment of asthma and other bronchial disorders that requires distribution of medication deep in the lungs. To, to accomplish this, the particle size of the micronized medication is prepared in the range of 1 to 6 micrometer in diameter. In addition to the therapeutic agent, these products contain inert propellant and pharmaceutical diluents such as crystalline alpha-lactose monohydrate. To aid the formulations, flow properties and metering uniformity, and to protect the powder from humidity. Powder blowers or insufflators may be used to deliver dry powders to various parts of the body, example, nose, throat, lung, vagina, vagina. Depression of the device's rubber bulb causes turbulence of the powder in the vessel, forcing it out through the orifice in the cap in the tip. Problems encountered in powder formulation. One is hygroscopic and deliquescent powders. The problem: absorption of moisture from air leading to the partial or complete liquefaction. The solution of this is that reduce the amount of surface area exposed to the moisture, packed in aluminum foil or in plastic film packets. Addition of light magnesium oxide to reduce the tendency to damp. Addition of adsorbent materials such as starch. Example, ammonium bromide, chloride, iodide, calcium bromide, chloride, ephedrine sulfate, hyoscyamine, hydrobromide sulfate, lithium bromide, phenobarbital sodium, potassium acetate or citrate, efflorescent powders. Is the loss of water or a solvent of crystallization from a hydrated or solvated salt to the atmosphere on exposure to air? The problem, crystalline substances which during storage lose their water of crystallization and change to powder to be efflorescent. The liberated water convert the powder to a paste or to a liquid. Example, alum, atropine sulfate, citric acid, codeine phosphate solution using the anhydrous form plus treating it in a manner similar to hygroscopic powders includes drying bulky powders. Eutectic mixtures, a proportion of components that will give the lowest melting point. The problem is that mixture of substances that liquefy when mixed, rubbed or triturated together. The melting point of many eutectic mixtures are below room temperature. Example, menthol, thymol, phenol, salol, camphor, etc. Solution using inert adsorbents such as starch, talc, lactose to prevent dampness of the water of the powder, dispensing the components of the eutectic mixture separately. Fourth, explosive mixtures. Oxidizing agents give oxygen to another substance. Reducing agents remove oxygen from another substance. The problem, oxidizing agents, example, potassium salts of chlorate, dichromate, permanganate, and nitrate, sodium peroxide, silver nitrate, and silver oxide explode violently when triturated in a mortar with the reducing agent. Example, sulfides, sulfur, tannic acid, charcoal. The solution is that comminute each salt separately, subject to a minimum pressure.